evening to all our viewers. Today we're joining us at Kopi With Vans as usual. The cup, the signature, we always do that, right? Before we start any talk shows. Alright, so cheers. Alright, doesn't seem right, but cheers for coffee, it's fine for now. Alright, so it's been an amazing week. I'm sure everybody is safe, staying fit and healthy as well. As you all know, that today's topic that we are coming back, it's about fight cancer. That's right. And today we also have our guest speaker, who is a very good friend of mine as well, Dr. Jaideep Rao, who's a senior consultant surgeon, and you'll be joining us very, very shortly. But the reason why we want to cover a topic today about cancer is because cancer in Singapore is actually one of the rising over the years, right? I'm just going to read out that is taken up from the NCSS, which is a very, very interesting topic that most of us know that, it's easy to type it out and find it out from Google, but sometimes, why do you want to do it, right? Sometimes we don't do that, right? But I'm just going to read it out that, and I just remember that cancer has been rising over the years, and the number of people living with cancer will continue to increase. And it's amazing, right? I mean, why is that suddenly, or even when we back in 1970s or 60s, I never heard about it. Probably I never heard about it means it doesn't happen, right? But nowadays it seems a lot, right? We see in all kind of ages, right? So that's where our guest speaker, our senior consultant is going to come in, and then we're going to talk a little bit pertaining to certain cancer that we decided to share today. But during the period of 2014 to 2018, there's 74,536 cancer cases were reported in Singapore, and out of that is 48.5% and 51.5%. So of those cases were reported in males and females respectively. So it's a bit scary, right? Those who are healthy individuals also have cancers, and those who doesn't smoke also have cancer. So it's a bit puzzling, right? Someone who smokes for the age of 80 years old and also doesn't have cancer. I think I don't want to go into too much on the stats, but rather we're going to share a lot of on our speech today, which with my guest speaker coming on board. So I'm going to invite, without any more delay, Dr. Jaideep Rao. Hi, sir.
Hello, good evening.
Hello, good evening. Good evening, sir.
Good evening.
Good
Nice to
evening.
see.
Nice to see. Nice to see you too. So I'm sure that you just came back a while ago.
Yes, I
Yes,
just
I just. So the life of a doctor never rests at all, yeah. I mean, always you're busy and always you're being engaged. So where do you find time to rest, doctor?
well, I
Well, I
it's a few
missed a
hours of
few
sleep.
hours of sleep.
Uh,
Uh,
I usually
I
try to
usually
get at
try to
least
get
about
at least
six to
about
seven
6 to 7
hours.
hours.
Sometimes it's
Okay. Times
difficult,
it's difficult,
but
but
we do what we
we do
can.
what we can. Okay. So thank you, doctor, for joining us again once more at Kopi With Vans. It's always a pleasure to have expert coming on board and giving some information on pertaining to certain illnesses. The other time we talked a lot of varieties that we talked about. So I think today we are going to point into cancer. Doctor, before we go on again, if you can just introduce yourself again, because we have new viewers coming on board as well as usual. It would be better for them to know you as well.
Yes,
Yes,
thanks
thanks
for
for
inviting me.
inviting me.
It's a pleasure
It's
to
a
be on
pleasure to be
the
on
show. My name is
My name is
I'm
I'm
an upper
upper
GI or
GI or
gastrointestinal
a
surgeon.
surgeon.
I practice
I
in
practice in
Medina
Medina
Hospital,
Hospital,
and I
and I
specialize in
specialize
upper
in
GI
upper GI
conditions,
condition,
stomach
stomach
cancer,
cancer.
rectal cancer.
Uh,
I also
I
do
also do
bariatric and
basic and
metabolic surgery
metabolic stuff
for weight
for weight
and
and
surgery for
surgery
diabetes.
for diabetes.
Uh,
Doctor, sorry, I just going
yes,
to stop you for a while. I think you might want to come a bit closer because your words are being distorted along the way. So I think it's a capture of the mic. So if you can
okay.
come closer, that'd be great.
Is this
Is
better?
this better? That's so much better, doctor. Thank you so much.
Okay.
Okay.
Yeah. So
Yeah. So
that's what I
that's
do.
what
I
I
also
do. I
do
also do
surgery for
surgery
hernia
for
and
hernia and
abdominal wall
abdominal wall
reconstruction,
reconstruction,
gastroscopies,
gastroscopies,
endoscopy.
endoscopy.
Uh,
Uh, Okay, this is what you do in our daily work, doctor.
yeah.
Yeah. All right, doctor. So let's jump into the topic itself. I just read a little stats about Singapore on the cancer. It's a little scarier because I just want to share a little story before I will pass it to you. I lost my dad, I think, in a 2 years ago. He was actually diagnosed with lung cancer. But the amazing thing is, there was no indication at all. Right, we were all just as normal as he could be. He just started out with a normal cough, right, and then he went to check, and doesn't seems good. The lungs became cloudy a bit, and then the doctor said you have 3 months to live. So it is just happened so fast, right? Our body turned against us. And what could be the reason, either for smoker or non-smoker? And eventually we lost him, right? I know in the medical field, it's always been a battle to find a cure for cancers. I mean, things are getting better, like chemotherapy and so on and so forth. But where we are at in terms of cancer, doctor, I mean, why is it our cells are turning against us? Maybe with that, we probably will want to go into the topic itself.
Yes.
Yes.
Firstly, I'm
Firstly,
really
I'm
clear about
clear
your
about your
dad and my
my
condolences.
condolences,
And this is
and this
actually
is
a
actually
very
a
common
very common
problem,
problem,
and it's
and it's
getting
getting
worse and
worse.
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 Senses are
Senses are
very much.
very much.
Uh,
Uh,
so there are
so there
various
are various
causes of
forms
cancer.
of cancer.
There are
There are
some
some
hereditary
hereditary
that you
that you
inherit
inherit
from your
from your
parents,
parent,
grandparents, etc.
that's right,
Family,
family,
and then you
and
have
then you
an
have
acquired.
an acquired.
Now,
Now,
acquired
aqua
are
are
more common,
more common,
and it is
and
the
it is the
that occurs
that
generally in
occurs
the public.
generally in the pub.
So these
So
acquired,
these acquired,
there are
there are
specific
specific
certain cancers,
certain cancers,
and then there are
then there
general
are
causes.
general causes.
Now, the
Now,
general
the
causes
general causes
are
are
smoking,
smoking,
uh,
uh,
stress.
stress.
These two are
These two are
the major
the
causes
major
for
causes for
uh,
uh,
cancer.
cancer.
Now, in terms
Now,
of
in terms of
gastrointestinal
gastrointestinal
cancers,
cancers,
for example,
for example,
stomach,
stomach,
colon, these,
colon, these,
it has got to
it
do
has
a
got to
lot
do
with
a lot
diet,
with diet,
and a diet
and
that is
a diet that is
with a lot of
with a lot
barbecued
of
food,
barbecued food,
pickled food,
pickled food,
salted fish,
salted fish,
processed food.
processed food.
All these
All
are
these are
high for
high
cancer.
for cancer.
Now, when
Now, with
lung cancers,
lung cancers,
smoking is the
smoking is a
most common
most
cause
common cause
of cancer.
of cancer.
Okay, doctor. So, I mean, it's still a bit puzzled because, back in 1960s or 1950s or even our early forefathers, right? We're talking this about 1909. Probably there wasn't. Probably there wasn't any medical facilities at that point of time to diagnose such a thing. But is there could be a reason why is it because we are too stressed and we are not taking care of ourselves? Is it could be one of the reasons? Because we know that an healthy individual who runs marathons or whatever, super fit, he can be a victim of cells turning against him. So what exactly is it? Is it because, like what we said earlier, is that one of the reasons, comparison to 100 years back?
Yes,
Yes,
definitely.
definitely.
Uh, the one of the main important causes uh, of cancer is stress, and it is shown in a lot of evidence that people who live in. Can you hear me? Am I audible?
No, you got good. Yeah, I'm hearing you.
Okay.
Okay.
Um,
Um,
like there's an
there's
echo.
an echo.
Yes, if you can come closer a bit, I think should be okay.
Okay.
All right.
Okay.
Yeah.
So
So
people have seen
people
like
have seen like,
the
the
longest and
longest and
healthiest
happiest
lives
lives
that people
that
lead.
people lead.
The people
The
have
people
shown
have
is in
shown is in
like
like
Okinawa
Okinawa
and
and
in Greece,
in
some
Greece, some
islands,
islands,
Sardinia,
Sardinia,
and one of the
and one of the
common things
common things
that
that
lead to a
lead to
healthy
a
life
healthy life
is low
is low
stress.
stress.
People.
People
It's mostly
is mostly
countryside,
countryside,
mountains.
mountains.
So and
So and
you're
you're
out of the
out of the
city,
city,
you have a
you
lower
have a
chance.
lower chance.
Are
Are
philosophically
philosophically
speaking,
speaking,
and in
and in
statistics that is
statistics that is
shown.
shown.
People living in the
People living in the
cities,
cities,
high
high
stress,
stress,
always on their phone, in presence of electromagnetic devices. So all these play.
Okay, so thank you, doctor, for that basic introduction, because I think it is still issue. I think not only in certain countries, I think all over the world that's still been an issue, because even if you look at HIV or kind of stuff, I think it's medications are there even for cancer as well. But I know hopefully in the medical field they do find a cure as soon as possible, because lots of people are losing their loved ones without any warning. I think that is really a surprise even for us also, because we didn't expect it, because he was actually quite healthy. But you never know. Before we even go into the topic, doctor, is there something like like a checkup that one should do, even in your line of practices? What would be the recommendation to do any markers? Because we know that there are certain tests that you do. You can actually find your markers, whether is it above or is it below. It's an indication, so it gives specialists or even like surgeons like you to find that, hey, this something could be wrong. We can do that. Is there some kind of a test that the publics or anybody should be aware of to do this, like a yearly or 6 months?
So this is because unfortunately, in terms of cancer, when it is early stages, does not produce symptoms. Lung cancer, you just small dot in a chest. The person is quite healthy otherwise and does not show symptoms. Same with stomach cancer or early colon cancer, or many of these cancers, liver cancer, pancreatic cancer. They're just a small, and when they produce symptoms, they're already in a late stage. That's why most cancers still are detected in advanced stage. Now, what people can do to get this detected in the early is screen. Now, for common cancer, we have screening. For example, the most common cancer, colon cancer, lung cancer. This we have screening. For example, for colon cancer, we have the fecal occult blood test, where it's a simple stool test, and if there is some blood, then we recommend them to go for a colonoscopic screening. In terms of tumor marker, we don't have a very clear treatment for a particular cancer. We do have certain tumor markers which people do for screening, but many of these are non-small, which means that you could have a normal level of that tumor marker, but you could be harboring a cancer. Conversely, you could have a marker level, but you could be not.
Okay.
So these are not specific. In terms of certain cancer, for example, in skin cancer, we have done a lot of research, and we are happy to that Singapore, we are the first country to produce a blood test that screen for stomach cancer. This is done by microRNA technology.
Sorry,
So,
doctor. We just have a viewer right now here saying that the sentences can't be heard properly. So probably I think the mic you're having right now, I think there's some interferences. Probably if you can just come up, if I just trouble you, just come a little bit closer, because
okay,
it's not capturing, so
I'm
it's
in a
giving a lot of, yeah.
I'm in a very big room,
I
so
see.
maybe it's an echo. Should I go to a smaller room?
Oh, you can. Let's do that.
Okay, okay,
Yep.
just
Please,
2
doctor.
minutes.
Okay. Yep, sure. So yes, we got some echo here. Usually we have all these technical issues, unpredictable, right? So doctor is going down to a smaller room to test whether there's some echo here. Probably I'm not getting it because we have done all the testings. Let's see, we are still left. But another exciting thing is going to happen here is we also going to have a guest speaker who's coming in, who going to share about his experiences about cancer, which he went through. He fight it hard, and how was his state of mind, and how he actually not say struggle. I would not say he's a guy struggle. He's an amazing guy, which I know him personally as well. and how was his mental resilience is all about, and how he actually fight through about it. So it's going to be in a while that we're going to catch him soon, maybe in another 5 more minutes. But let's see if we can get Dr. Jaideep, see if he can actually settle the echo issue. Then probably we will get our guest speaker coming in to find out. All right, so let's see if we have solved the echo issue right now. Hi, doctor.
Hi, is it better?
Is it that?
It's so much better. I think you just have to come a little bit closer. I think we are done. That'd be great.
Okay.
Okay.
Okay, doctor. So please carry on. Thank you. So he was talking about the markers. That's where
Yes.
we lost you.
Yes.
There are some.
There are some.
We are proud to
we are
say
proud to say
that we have
that we
a
have
marker to detect and screen for stomach cancer,
stomach cancer.
and this is
And this is
microRNA technology.
microRNA technology.
So we've been doing this research for quite a few years, more than 10 years,
10 years.
and
And
we look at microRNA. So what it does is it looks at certain risk.
certain risk.
So if a
So
person
if a
is
person is
smoking,
smoking,
this shows
shows
as certain signals on the
on the
microRNA.
RNA.
If a person has a history of gastric cancer, family history of gastric cancer, this will show up this RNA.
RNA.
If somebody
If
has
somebody
some
has some
stomach some changes,
changes,
a Helicobacter pylori bacterial infection, which is predisposing for stomach cancer. All these go on their microRNA much before they actually develop cancer. So we did a study on patient, and now we have blood tests that can put somebody in a category. So we can tune them to say whether you're low risk, medium risk, or high risk. And therefore we can focus on these medium and high risk, and actually then can undergo further tests such as endoscopies, etc.
Thank you, doctor. Thank you so much for that. On the markers and the current technology that we have to actually to identify that, I think that is one of way to prevent it. But we have a guest who wants to come up. His name is Eli, who actually have. I mean, he's an amazing man. I think he went and battled the fight and given a hard fight, and he came back. And he's his mental status is such a great resilient. So I have pulled him up. So he's going to come up in a while. So let's hear his story and how he was and what is he doing right now. So let me pull Eli on top. Hi, Eli.
Hi, Vadan.
How are you, sir?
I'm doing great. Thank you so much for having me on this show.
Thank you for joining with Kopi With Vans once again. So with me today is Dr. Jaideep Rao, who's a senior consultant surgeon here with us, and this is Eli. So nice to meet you both our guys. I do the introduction for you all.
Hi, Doctor.
Yeah,
Hi.
but
Meet you.
okay, so you're going to shake hand, you're going to shake hand like that.
We do a high five.
High five. Okay. I know, Eli, you are such an amazing, such a wonderful soul, because I remember last year during the Kopi events, you came on board and shared your experiences about cancer and how you fought it hard, and you and take part in so much of cancer society's events and all that. Maybe if you can just give us a short intro about yourself before we even go into the topic, and then we can share and discuss.
Sure. No problem at all. So I was diagnosed with both rectal and testicular cancer in 2011. And my rectal cancer left me with a permanent stoma, which means I need to wear a stoma bag to collect my stool, right? So it was surgery to remove the tumor, drain the stoma. Then it was 28 cycles of radiation and 8 cycles of chemotherapy. So it took me the rest of 2011 for the treatment. After that, then I started to get back to life as I knew it. So I didn't want the cancer to stop me from doing what I was doing.
doing.
So I took up brisk walking, swimming,
Swimming,
and
and
I did a few
I
half
did a few half
marathons and I
marathons
completed
and
a
completed
full
a full
marathon.
marathon.
And then
And
I
then I
decided that
decided that
there was more
there
to
was
life
more to
than
life
just
than just
living day to
living day to
day.
day.
So I
So
found I tried to
I
find
tried to
ways to
find
give
ways
back
to
to
give back to
society.
society.
So I got
So I
myself
got myself
involved in
involved in
several support
several
groups
support groups
in Singapore
in the
Cancer
Singapore Cancer
Society,
Society,
uh, Changi General
Changi General
Hospital,
Hospital,
Singapore General
Singapore General
Hospital,
Hospital,
and National
and
University
National
Hospital.
University Hospital.
Right, just to
Right,
provide
just to provide
psychosocial support
psychosocial support
for newly
for newly
diagnosed cancer
diagnosed
patients,
cancer patients,
and to tell them
and to
that
tell
there
them
is
that there is
help out there.
help out there.
So there's no
So
need to
there's no need
despair.
to despair.
That there is
That
hope.
there is hope.
That you can
That you can
still have
still have
a very high
a very
quality of
high
life
quality of life
with your
with
stoma,
your stoma.
and
And
usually to
usually to
get my point
get my point
across,
across,
I
I
engage in
engage in
activities that
activities
not
that
only raise
not only raise
funds
funds
but
but
also
also
show people
show
that you can
people that
still
you
do
can still
things. So
do
I
things.
went
So
on
I went on
a
a
Gobi Desert
Gobi Desert
expedition in
expedition in
2018.
2018.
So I trekked the
So I
desert
trekked the
with
desert with
some
some
survivors and
survivors and
caregivers.
caregivers.
And then in
And then in
2019, we went
2019, we
to
went
the
to the
mountainous areas of
mountainous
northern
areas of
Mongolia,
northern Mongolia,
where the
where the
reindeer herders
reindeer
are.
herders are.
The temperature is minus
The temperature is
35.
minus 35.
So we spent
So we spent
some days
some
trekking there
days
as
trekking
well.
there as well.
So the whole
So the
message
whole
that I want to
message that
send
I
out
want to send
to
out to
cancer
cancer
survivors
survivors
and people
and
living,
people
living with
living with
stomas
stomas
is that
is that
there is still
there is
so much to
still so
life.
much to life.
You can do
You can
stuff,
do
right?
stuff,
Don't
right?
let it hold
Don't
you
let it
back.
hold you back.
Just consult your
Just consult
doctor.
your doctor.
And also
And
because we
also
have
because
skill
we have
sets
skill sets
that are highly
that are highly
developed,
developed
and
and
it's such a
in such a
waste
ways
if you don't
if
use
you
them.
don't use them.
So make use
So
of
make
all
use of all
the skill set
the
that you
skill set
have.
that you have.
Find
Find
opportunities to give back
opportunities
to
to give back to
society.
society.
And
And
this
this
initiative that we
initiative that
have,
we have,
which is called
which is
Cancer
called
Can Give,
Cancer Can Give,
provides this kind of platform
platform
where we can
where we can
get involved
get
in
involved in
activities,
activities,
helping the
helping the
elderly,
elderly,
helping the environment, and teaching the young. Yes.
Thank you, Lai. Thank you so much for that humble introduction and what you have went through. So we going back to doctor now. Doctor, I mean, for someone who have, I mean, it's unimaginable, you know. I mean, Eli just told us his experiences, but how do you manage this, doctor? I mean, day in, day out, you are seeing. I mean, of course, you are rescuing, you are helping, and kind of stuff. But how do you have that mental state, doctor? I mean, you always see people with conditions. How do you actually overcome that?
Yes, it's a very good question with a very difficult answer. Uh, the reason why actually at least me, I have taken up this profession is because um, I feel I liked and I was very passionate about this, that I'm helping somebody. My mother was a doctor, my grandfather was a doctor, my mother's brother was a doctor. So right from childhood I've been in this family, and I've been inculcated from childhood about this, and then I've grown to have a passion for treating this. And yes, it is. It is quite stressful to see this on a day in and day out basis. But at some time, uh, I had my mentor when I was studying medicine, and when I saw the first time in the ward, I saw a patient die. It affected me a lot. I cried. I was thinking, what is this? And I went through what a normal human being will have a natural reaction to. But then I sat with my mentor sat with me, and I'm a surgeon. So he told me, look, as surgeons, we have to be a bit of extraordinary. We have to be like the Avengers. There is no time for us to get emotional. We have to give 100% to the patient. We will win many battles, but we'll also lose many battles. But if we are feeling down when we lose those battles, you remember that there are a lot of other patients who are alive and need your full attention and your concentration to them. Once somebody, if we lose somebody, then we have no time now to cry over it. We have to look at the people who we need to rescue, who are still alive and can be rescued. So in a way, we have to be a bit emotionally detached. And over the years of treating patients, we develop a certain, uh, for a lack of a better word, a cold heart. We still empathize with patients. We feel still bad every time we lose somebody. We feel very bad about it, but you know it's like a an automatic door that closes, because we know that we can't be spending so much, because there are so many other people who require our best. So it's a difficult situation, but we have to do that. And after few years, we get used to it. In a way, we never get used to it, because we always, if somebody doesn't make it and somebody's unsuccessful, we always feel very bad. But I always remember my mentor's message that we have to keep ourselves 100% to fight the next person.
Thank you, doctor. Thank you for that explanation, because it's coming out from you. But as doctors, I always see that they are always so focused in what they do. Because imagine if you are someone who is very emotional, a doctor is very emotional, probably you are not able to do what is necessary. I think so. I think it's such a state of resilient mindset that you practice that. I think all doctors practice that. Thank you so much. So now we're going back to Eli. Eli, I know you have been actively involved in a lot of society work. You've been doing marathons, runs, and all that. But is there been ever like a emotional period where when you're alone and when you started to think about it and tear? Will you mind sharing that? Because it requires a certain level of mindfulness to be in that stage of understanding. But a lot of people will not, unless it has anything to do with them, then they start to panic and all that. Because other than that, they will be saying, oh, okay, so and so forth. Because it's just, could be sometimes words, but it's how is a person feeling, the expression, the emotionals. How will you been and how is your mental state was then? Do you fight it or you just let it to set on you? What was going on with you?
Right. So I think I can see three distinct phases. The first one, of course, when I received the news that I have cancer. Right. So it was devastating. It was not one cancer but two cancers plus the stoma, so it was a triple whammy. So personally, for me, I then just a brief period of reflection. What brought this on? I wasn't exactly living the healthiest of lifestyles. So all the risk factors were there. And so when I actually contracted it, there wasn't any way to ask, why me? Because it was more like, why not? Right? So when you accept the fact that you have this, then the next stage is going through the treatment. Um, so I don't know whether I am naturally strong in my mind, but there were people that I needed to take care of, like my late mom and my wife. So I needed to be there for them. So that was a big motivation in looking forward to getting better, right? Um, that was all right. The second phase, being strong and going through the treatment and wanting to get better and focusing on the treatment. And of the third phase, I think, was really, and I quote this ad nauseum, to anyone who's willing to hear. Mark Twain's quote, right? The two most important days in a man's life. The first is the day he's born. The second is the day he finds out why. Right. So I think I found my purpose. It was to reach out and to help other patients who are in a similar situation. so that they don't have to go through the things that I went through. And that really now is the thing that I live by, and that is my main motivation. Yeah.
Thank you, Eli. Thank you so much for that. It's amazing how you, because I follow you very closely on your social media, and I do see how you actively involve and giving back. Rather than giving back, I gotta say it is more about you. Like what you said, you found out why. So I think that actually you have done a fantastic and a phenomenal job there. Thank you, Eli. So, Doctor, we are now going to go to the topic, which is of course we are relating to the stomach cancer, but is there any way one should able to do some preventive tests? Of course, it's not right to say if you eat certain things you get, or you don't. We can't say that, but right. But what could be the possibilities of one could have an stomach cancer? Because some hereditary, or is it something to follow up, or what could be the reason, doctor?
Yeah, so we know that there are a few known causes for stomach cancer. Um, One of them is smoking. The second is an infection of the stomach called as Helicobacter pylori. So this is a bacteria that commonly affects the stomach, and it survives in the acidic environment of the stomach. And it's very endemic in Singapore, but it's also very endemic in Asian countries, especially Japan, Korea, China. So all these areas have one of the highest stomach cancers in the world. In addition to, so this Helicobacter pylori infection accounts for 90% of people with stomach cancer. Then you have the type of diet that people have, and as I said before, is having barbecued food, things that are char grilled, where that the tar is there, pickled food, salted, fermented food. All this can contribute. High salt food, processed meat. So the first all causes are usually for stomach cancer. Processed meat is more for colon cancer, because, and especially when you have meat, meat is basically digested in the body, and the certain compounds are converted, which is a bit carcinogenic. So nitrosamine compounds are created, and this is toxic for the stomach. So in general, a vegetarian diet or a plant-based diet is healthier and gives you a lower risk of stomach cancer, colon cancer in general. Now that does not mean that, oh, just because you're vegetarian you will not get these cancers, or just because you're a smoker you will not get cancers. So there is a small group of people that do not have any risk factors, or let me put it that we do not know the risk factors as yet, or why these people have got it, because nowadays we are living with so many uh, possible risk factors. It's very difficult to pinpoint to a certain risk factor, but we have this huge risk factors, living in presence of electromagnetic waves, and above all this is stress. So when you have all these hits and then you have stress on it, yes, then that can give rise to this cancer. And yeah, so these are some of the common things that can occur.
Boss, you're muted, boss.
Vance, you're muted.
All right,
Vance,
can
you.
you hear me now?
Yes.
Now? Okay. So yeah, so hopefully we can find a cure in the medical field for this. Of course, doctor. As we move on, we also want to know that a little bit more on that. In Singapore itself, I think the first highest is it lung cancer, because it seems to be one of those highest in the numbers.
Yeah.
Is that
So
right,
it's
or we don't have?
colon cancer in terms for male. I mean colorectal cancer
Okay.
for male, that and lung. Then of course for women is breast cancer and cervical cancer.
So Eli, so what is your next project, sir? I mean, you have been doing a lot of work for the Cancer Society. I mean, we always see you in every part. I think the reason, I mean, of course, not during the or rather pre-COVID, you were doing with, with Cancer Society and so forth. So is there something that you're already planning ahead, with virtual, to create awareness to bring this forward?
Yes, actually, come to think of it, some of our support group work, we used to visit patients in the wards in SGH, when they just get finished their surgery and before they go home to offer some encouragement. And we've actually organized something to bring that online. So we call it POSH. It's Patients Online Support Hub. And every Tuesday afternoon, they just come on, and we patient members go on as well, and then we try to give them, some psychosocial support. And then we had our virtual Relay for Life back in March, and we're planning ahead again in 2022. Things have already started. And of course, I also head the Ostomy Association of Singapore. And we are looking to bring more patient and healthcare professional education series to members of our Ostomy Association, those who are living with ostomies, to provide them with more information by way of products, as well as knowledge to help them maintain or improve their quality of lives. And also trying to touch base with the authorities to provide better amenities so that ostomates can go out in the public confidently and live a near normal life as possible. Yeah. So these are some of the projects in the pipeline.
We wish you all the best, Eli, for all the upcoming projects and what you are currently doing. Thank you so much for joining us today. It's a great pleasure again to share your views and your resilience. I really appreciate the way you do things because of your mental resilience, and you have a purpose for it. And it's either someone makes it or either they break it. But I think you just crushed it, and because your purpose was bigger than anything else. So with that, thank you so much for joining in at Kopi With Vans. We will meet up again. Thank you so much, Eli.
Thanks a lot for having me.
Thank you
Congratulations
so much. Thank
again.
you. I'll see you
Yeah,
around. Bye bye.
it was
Thank,
lovely seeing you.
Thank you. All right, doctor. So that was Eli. I mean, there will be a lot of people just like Eli, very strong. But do you think it's also to do with? I mean, of course, it's not right to say that. Of course, with medical, which is of course the medicines and therapies and the kinds is very important. But will there be like say a 10 to 20%, or maybe rather 10% of mental resilience that they don't give up, they fight for it? Could that be also a factor for their body, or do you really think no, it is the symptom, it is have to go through because you are in the line? What will your take be, doctor?
Yes. Well, definitely mental resilience plays a role. We do have, when we see patients of all categories. When they come, of course, nobody is really thrilled to hear of the diagnosis, and different people respond with varying degrees of despair. Uh, and different people uh, are able to get over it, pretty quickly. I'm actually quite impressed with a lot of patients who, okay, yes, okay, now it's bad. Okay, what can we do? And let's, sort it out and just treat it like a mathematical equation and say, okay, this needs to be done. This plus this. Okay, we'll sort it out. And maybe they are hiding it inside, or but they do that. Of course, there are a lot of patients who are psychologically traumatized, and they require a lot of psychological counseling too, and it's totally understandable. So we do see a whole specter of reactions. As a doctor, of course, I would say that the stronger the mental resilience and the faster you come to terms with it and go with the treatment recommended, then that's good. Of course, it's easier said than done, because when you are going through, only you can realize how the situation is. Uh, what I would say to people is that especially in Singapore, the general level of care and advice provided by the doctors is really good, and they should trust that and go ahead with a treatment plan. I see a lot of patients, they're unsure, they take 10, 15 different opinions, they Google a lot of things, they come up with a lot, uh, but instead of just trusting their doctor and just going ahead with the treatment, and they waste a lot of time with that, and this is not beneficial. Yes, sometimes the outcomes are not always desirable. Complications do occur because it's a long journey, because they need a lot of investigations, they need mini interventions, endoscopic interventions, they may need surgery, they need chemotherapy, after that maybe radiotherapy, and it's a prolonged treatment and it's very frustrating, and a lot of the times they do it. But in general, the standard of care here is pretty good, and ultimately even the doctors want you to be well and get well soon. So they must realize that we're on the same team fighting, and when they are together, then the treatment becomes much easier, and when they're in a positive frame of mind, their healing is also much better.
Thank you so much, Doctor, for spending almost about 45 minutes into our show. And we do understand that, a lot of stuff that we talked about, even though how one should be, so focused in mental resilience and fight through, but of course, they shouldn't be forgetting the other part, which is, of course, the procedures of the medical field that is very important as well. Not to, I mean, of course, like I said, a lot of people have their different opinion and options. But based on my experiences, in fact, the doctor was very precise. That's what's actually amazing to me because he says that, okay, 90 days. So we all looked at him and said, 90 days? Okay. So he was very on the dot. And to be very honest, the cycle, right? I do know a little bit of, a little science, not so much, still learning. In order for the whole lungs to actually to collapse, or even to a factor of almost covering up to 70 or 80%, and then oxygen intake, when there's a lot of carbon dioxide, you actually become a poison of your own self. So it was a very tremendous situation to see that, that one person have to go through that, especially if it's known earlier. Will that be possible? Or even for the matter of even at the last stages, where we know, right, it's going to depart. But what's the amazing thing is that the doctor still give us option. He said, do you want for another 2 more weeks, so we can do another procedure to via the rib cage to to let him breathe. But we thought, say no, that will be going to be very painful. I think it's time for him to go. But will that be possible if we know this way much more earlier? That because see, the symptom was very simple, right? The symptom was just a cough. So most people would think, hey, cough, but by then it's already your last stages. So it's a bit scary how our own cells turns against us at some times. So
Yes.
I think, like what you said, regular checkup is very important. Even HbA1c for diabetes, usually we wanted to cover, but unfortunately you were held up. So that topic probably will cover along the way. I think that is also important to find out your blood glucose level. You
Yes.
have to go and check your cholesterol level and kind of stuff. So for cancers, do you think yearly is good enough, or is it like 8 months or 6 months for
Yes.
the markers?
Yearly is good enough. I mean, different. It depends on a lot of factors, because we can't be yearly checking up for everything, because there are so many things, right? There's lung cancer. There's gastrointestinal cancers. We can't be CT scanning ourselves every year and things. So we have to identify some risk factors. if you go for screening with a doctor, go through your detailed family history, whether you have any family history of cancers, whether you're a smoker, uh, what is your dietary, lifestyle. So if you're a smoker, then definitely I would recommend you to get, an X-ray every year, look for any small abnormalities, and actually screen and, catch it early. Just like if you have a family history of heart problems,
Even HbA1c for diabetes. Sorry.
you can do that. And so similarly, like if you have a family history of stomach cancer, then you would want to get an endoscopy done early. Now we have blood tests to check, and same goes with, a colon cancer. So depending on what you feel, the doctor feels that you are at a risk factor for, then it's good to screen. Of course, there are general screening that are there for, various things, and that is good to have that once in 2 to 3 years, so that anything that is picked up, at least you pick it up, in a slightly early stage, because early stage actually gives rise to good prognosis. Nowadays we have very, very sophisticated, treatment, and if early stages of most cancers, the prognosis is very good. With minimal intervention, you can actually be almost completely cured. For example, if you have an early stomach cancer, very, very small ulcer, we could endoscopically remove the tumor, and you don't even need a surgery. Even if it's slightly bigger, we can do keyhole surgeries to remove it, laparoscopic or with robot. And it's very precise with minimal morbidity, and outcomes are very good. But once it's, spread to different organs, when it's very large, then it's more challenging. Then you require adjuvant chemotherapy and stuff like that.
Thank you, doctor. Thank you so much for the insight. I mean, of course, it's a topic that we can keep on talking, because it's very in depth as well. So thank you so much for spending almost about 15 minutes, almost 1 hour. And I do not want to hold you back, because I can see that you actually had a very long day, because we had an earlier discussion as well. But with that also, you still want to come in and then want to give a talk session with us. So I really appreciate that. And I know at the backstage you were actually was having a quick dinner. So probably you're also rushing for time. So thank you so much for that effort, and joining us second time at Kopi With Vans. Thank you so much, doctor.
Thanks, Vance. It's always a pleasure, and it's always nice to share things with, everybody, so that we're all here to learn together and fight against, this condition, which is getting more and more common, and is one of the leading causes of death in the world, and something that is preventable and treatable. So again, and to Eli, big congratulations for fighting through it. I too have a lot of patients who have undergone, treatment, and who are. It's a pleasure. We lose many patients, but every patient that we save, this is really what we live for, and it gives us immense satisfaction, in our work.
Thank you, doctor. Thank you so much. I'm sure we are going to do another topic coming up very soon as well. So till then, I is my greatest appreciation to you, even though it's late and I know you are tired too. But thank you so much for that. Please do get some rest as well, and we will meet up really real soon on our next topic.
Right. Thank you, Vance. Have a good night. Thanks,
Thank you, doctor. Thank
everybody.
you so much.
Thanks for
Thank
having
you.
me.
Bye bye.
Bye.
Bye. All right, folks. So that was actually a doctor who just got in with us, and Dr. Jaideep Raj Rao, senior consultant, surgeon. I mean, we shared a lot of stuff on his practices. We talked about, it's something that's related to the medical field, and it's always pleasure to have him back at Kopi With Vans, and always a great topic to talk about and to share and see where we can actually move on. So that would be very great. So we will be coming back again for our next topic next week on a different topic as well. And this time we are going to cover lifestyle and health topics together. So either one we will take place. So that is coming up real soon on your next Kopi event. So this is Vance. Will be joining with you again on your next Wednesday at 9 p.m. So for now, I'm signing off. This is Vance. Adios, amigos.